postman.
Splendid. Let's see. Yes, here it is.
What are they?
My medical qualifications. Careful, the ink might still be wet. Don't want to smudge them.
No.
Duplicates, of course, of the originals. Sadly lost at sea.
Oh, it's very choppy. I'm surprised more things don't get lost there.
Quite.
Where shall I put your egg?
Well, I'd better have it in here. I'm keeping an eye out for the medical examiner. I don't want to be caught at breakfast.
No.
Got to look busy.
Yes.
A busy, successful practice means a busy, successful doctor.
Call for Dr. Clark.
Patient to see you, Dr. Clark.
Dr. Clark's practice. How may I help you?
We present Dr. Clark's Country Diary of a Country Doctor.
Go straight in. The doctor will see you now.
Well, that'll have to come off.
Episode 4. Settling back.
Now you know what you need to do.
Yes. When the examiner comes, I ring the front doorbell and I pretend to be an emergency.
That's right. You're dying, gasping for air. Good, clean, fresh air, and you can't get enough of it, May. You can't get it into you. Your lungs just won't work.
Oh, no, won't work.
Then I shall have to perform an emergency procedure, and in next to no time you'll be so much better, you'll be yodeling again.
Yes.
You did learn to yodel.
Oh, yes, I was up every night this week practising.
I didn't hear you.
I did it under my breath so not to wake you. Now you must eat something. Here's the egg. It's hard-boiled, so if you have to leave it in a hurry, you can always start on it again tonight.
Excellent. Oh, a car.
It must be the examiner.
Quickly, get these qualifications framed in a display case and hung on the surgery wall.
I shan't have time.
This is an emergency, May. You must make time.
I can't.
Did Nelson say can't? When he put the telescope to his blind eye, he didn't say, I can't see those ships. He said he could, and he was right, May.
He was. That's how he got killed.
Exactly.
I can do it.
That's the spirit, May. Step up. I can always count on you. Off you go.
Oh, yes.
Oh, it's all right. It's some woman.
Dr. Clark?
Of course. I'm afraid I'm not seeing real patients today.
I'm not a patient.
I think I'm the best judge of that.
I shall be the judge. I am Millicent Purley, from the Medical Board.
They sent a nurse?
I'm a doctor.
Don't be ridiculous. Women doctors are only in books.
I assure you I am. Here is a list of my qualifications and a letter of authorization.
The ink's as dry as a bone. Probably had it hanging in front of a fire. Have you had it hanging in front of a fire?
I beg your pardon. What's that noise?
What noise?
A hammering.
Oh, yes. That's just my wife doing a little spring cleaning. You can't look at her face.
I don't want to look at her face. Now, shall we get on? I trust you're seeing some real patients today?
Of course. Bound to. I'm a very busy man in a very busy practice.
Oh, they're coming. She mustn't see me, or she'll know I'm not a real patient later.
Come in, come in. You see that on the wall there?
No.
Oh, stupid woman.
There's someone climbing out of your window.
What? No, I think you'll find they're climbing in.
What?
Climbing in.
Who is?
You are.
Oh, whoa!
It's Mrs.
Nelson.
Yes, why not? Nelson.
You often come in at the window, Mrs. Nelson? Oh, yes, always.
No.
No, I'm an emergency.
Yes, Mrs. Nelson is an emergency. Why didn't you say so? Sit down. Can you sit down?
I don't know, can I? Oh!
Yes, you can.
What exactly is your complaint, Mrs. Nelson?
Just a moment, I am the doctor. Kindly do not come between the doctor and his patient.
I'm sorry. You're quite right, of course. Please, proceed.
Now, what seems to be the trouble, Mrs.
Oh, I've lost my voice.
Have you?
Yes, and I can't yodel any more.
What a pity, what a pity. Mrs. Nelson is one of the village's best yodelers.
One of them?
Oh, yes. No doubt she needs a tracheotomy. It just so happens.
It might be a throat infection.
What?
Might be a throat infection, or any number of things. I don't think we should jump straight to a tracheotomy.
You shall not jump anywhere, madam. I'll do the jumping. Now open wide. Your mouth, May.
Ah!
Yes. Yes, a clear case of...
Could be tonsillitis.
Will you be quiet?
It's just another possibility. Surely you don't want to perform unnecessary surgery on a patient?
No.
I mean, it might be she only needs a short course of antibiotics.
A short course of antibiotics? Do you mean pills?
Oh, that sounds very good, doesn't it, dear? I mean, Doctor. Dear Doctor, if I may say so, Mrs. Nelson, your voice seems quite strong.
It comes and goes.
Are you in any pain? No? Oh, yes, you trod on her foot.
I did not. Now I have had enough of this nonsense. I shall treat my patient.
Very well, and I shall note everything for my report.
Now I'm going to cut into your throat and insert a small tube so that you will be able to breathe properly.
Righto.
Because at the moment you are struggling for breath.
Oh, yes. Oh, yes.
Don't worry, May. I shall pretend to make an incision, then you pretend to hold the tube in place.
Right. Don't worry, Mrs. Nelson, if you decide to sue for medical negligence later.
Will you stand back? You're in my light.
No.
You're just going to stay there and watch like some sort of ghoul?
Yes.
All right, May, change of plan. I shall have to carry out the whole procedure for real.
Oh.
But when she's gone, I shall stitch it all up again as neat as you like.
She does sound breathless.
Of course she does. Now, relax. This will hardly hurt at all.
Dr. Clark, come quickly. My wife's gone into labour.
Communist, eh? Don't worry, I can have her certified for you.
No, I mean she's about to give birth. We're not on the phone, you see, and my car's broken down.
We can take her in my car.
Don't be absurd. I can deal with a simple birth. Where do you live?
Across the road. It's Milligan. We're both patients of yours.
Well, that's splendid. It saves a lot of time.
Is Mrs. Clark all right?
Of course she is. Why do you ask?
She seems a bit breathless.
Oh, you spotted her rushing about the shops to do... yes, well, she's probably getting some biscuits for you, madam. You look the sort to eat biscuits. But come along, Mulligan. There's no time to waste.
Milligan?
What about Mrs. Nelson?
Oh, she's much better. Look, there's colour in her cheeks now.
They're blue.
Pull yourself together, May. There's no time for an operation. Deep breaths. While we're away, get those qualifications up on the wall.
No operation. I feel better already. All this fresh air.
Told you so. Come on, Henderson.
You're sure you're all right? Yes, thank you. He is a good doctor, you know. No one gives him a chance. He cut off Professor Prink's finger by mistake, and it's not the first time. If I was going to have part of me cut off accidentally, there's no one I'd want to do it except Dr. Clark. No one would do it except Dr. Clark. There you are, then. That speaks volumes. Nick is never afraid to step up. So long as you're all right, Mrs. Clark. Oh, you know who I am. There's a wedding photograph on the mantelpiece. Oh, Nick told me to get rid of it. But have you ever tried moving a mantelpiece? I won't say anything in my report. I shan't need to. Now I must stop him, whatever he's doing. He does try so hard. Why won't they leave him alone?
Push! 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 Come on, man, put your back into it.
I'm trying, but there's something wedged against the door. It's the wife. She's collapsed on the kitchen floor.
Is that you, Fred?
No, it's Dr. Clark, and you are impeding my progress, which is a criminal offence. Out of the way. Let me see. Good grief, there's another woman in there.
I came through the front door. Don't worry, Mrs. Milligan, I'm a doctor. You're in safe hands.
Don't listen to her. She's not even a nurse.
I am a doctor.
Poppycock. Right, we've got to break this door down.
I'll get my axe.
Why don't you come round the front, you idiots? There now, Mrs. Milligan. Everything is proceeding nicely.
It's all right, Mrs. Blenkinsop. I'm here now. Good heavens, what a mess. Your kitchen floor is covered in water. That's very unhygienic, you know. Pregnancy's no excuse for slovenliness. A woman can work up to the 79th week of pregnancy.
79th week?
Well, something like that. day, perhaps. I don't know. There's no excuse for this mess.
What's happening? Are you all right, Nancy?
I think it's coming, Fred.
I'll be the judge of that.
I can see the head.
What the? Good heavens above, that's not right. It's deformed.
Oh!
Let me see.
Don't be ridiculous, man. You're the father. You should be outside, pacing up and down and smoking.
You're right.
Don't worry, Mrs. Milligan. The baby is not deformed. Everything is fine.
She needs a midwife.
No, she doesn't, because I am a doctor.
A doctor should be standing quietly aside, waiting to offer advice if needed, maybe reading the latest periodical, exuding confidence and calm, while the midwife gets on with things.
And one last push.
Ah, here's the mop and bucket when you feel up to it.
Oh, one more push. Oh!
There now, satisfied? That baby's got 2 heads.
It's twins.
Oh, thank you, nurse.
Doctor.
Thank you, doctor.
Don't mention it, my dear.
She was talking to me. No, I wasn't. I was thanking Dr. Clark. What? Why, for heaven's sake? I know you did your bit, dear, and thank you. But the way he stood there, a little aside, exuding quiet, confident calm, and leafing through my laundry magazine. Well, that's a proper doctor for you, that is. And after all, he is a man. Oh, I give up. I think I've got more than enough for my report.
Did you say exactly what I told you to say, little lady?
Yes, Dr. Clark. I said she must come to the golf club at once, because you've had an accident.
Splendid. Now, while she's dealing with me, you go to her car and you swap the report in her briefcase with this one here. Understand?
Yes, Dr. Clark.
Don't mess this one up, Eddie. I'm relying on you.
Yes, Dr. Clark.
She's coming. There, that's her car. See?
Yes.
Off you go, then. Swap this report with the one in her bag. Quickly! Oh, golf ball, golf ball.
Hello? Dr. Clark? Are you all right? The boy said you'd had an accident.
Who's there? Is that you, Mother?
No, it's me, Dr. Purley.
You can't be a doctor. You're a woman, I think. It hit me on the head, Mummy. Why don't the big boys play nicely with me?
Let me see. What hit you?
This. Some mad golfer who doesn't look before he hits the ball.
That's a hard-boiled egg. Very hard-boiled.
Oh, breakfast.
I can't see any cranial damage.
Do you know what that would look like?
Yes, I do.
Then you mean I might live?
I wouldn't be at all surprised.
Thank you. What a gift you have. You really should become a nurse, you know. It's a pity to waste such skill.
I'm going now to file my report.
Well, I'm sure it's very balanced and fair. I assure you I shall abide by the committee's decision.
You will have to.
Yes, we'll all have to. Goodbye.
Come out from behind that tree, Eddie. She's gone.
How did you know I was behind the tree?
Your ears stuck out either side. Did you get the report?
It wasn't there.
What? Are you sure?
Yes. The bag was empty, except for a packet of biscuits.
Damn it! She must have sent it by post. What did you do with the other one?
Left it in her bag.
You imbecile! No. Wait. Pass me my golf clubs.
Oh, no.
Yes, this one will do. Oh, I haven't any balls. The hard-boiled egg. That should do nicely.
Ah! Oh. It went down there. It's hit her car. She's crashed into a tree.
One thing about a long medical career, lady, is knowing the advantage of a little tap in the right place. Now, all we have to do is set fire to the contents of every postbox in the village before they're emptied tonight, and we're in the clear. 4.
Where am I?
You're all right. You're in hospital.
I can't remember a thing.
All you need is some rest.
Who are you?
I'm Dr. Hollis, the senior registrar.
Doctor Clark! My report!
It's all right. It's been sent to Professor Prink.
Ah, sent. Yes, that's right. Oh, what a relief. If that man is allowed to practice a moment longer. You're sure it'll be all right, Nick?
Certain. Confirmation of my right to continue doctoring will be here any day.
The postman's off sick with a burnt hand at the moment, but I expect he's learning to use the other one.
May, the wall. You managed it. My qualifications.
Yes, the ink dripped onto the carpet a bit, but you can still read the important parts.
Nicholas Ark M. Doc. Oh, where's my pen? Ah, that's better. There. Doctor.
You have been listening to Dr. Clark's Country Diary of a Country Doctor, featuring Michael Kleptopico as Dr. Clark and Nellie Aberdeen as Mrs. Clark, with Noreen Coppice, Graham Gaspett, Gillian Scoopley and Noggins Grimley. The programme was devised in association with Seth Motherstock and produced by Ricky Laughwater. It is a British radio programme for 1951.